what we're going to do now is we have some questions that we've prepared to kind of prime the discussion. We're going to start with those and then open it up to questions that you folks may have. And as we go through, we'll mix a combination of both. We talked a little bit about this before we started, and they're very interested in your questions as well as some of the main topics that we want to talk about. And we're in a very good, unique situation where we have human service workers, college administrators, as well as faculty on our panel, but who've also been through the system. So there's multiple perspectives that we have. We have three strong women, but we probably have 15 different perspectives coming from the panel of three women. So I'm going to start with a question that is hopefully on a lot of folks' minds, and that is just from your perspectives, what advice do you have for social workers, new social workers, on the best way to serve the children, young people that they may be working with, families as well? And as part of that, were there things that you would say were good experiences or good characteristics, and those that you would say would probably be better if they were not part of that experience that you had in answering your question? And I think if we just go the same order and giving you each a chance, that would probably work best for us. So.
Well, the advice that I would have to someone, and Claudette touched on it, is to listen to the children. They're not numbers, they're not case numbers. Listen to what they have to say, and because that shows that you care. And not only listen, but follow through. I had a foster mother who was abusive to us under the guise of religion. She would beat us every night because she said that she knew that we had did something during the day that she didn't see, and to spare the rod was to spoil the child. And so that was part of our nightly ritual. We would get several licks before we went to bed. And that was in the home that I was in with my foster brother and with another foster child. And I was the oldest at 8. And I told the social worker what was going on in the house. Well, she marched me in front of the foster parent and said she reported that you did this. Well, you know what happened when she left. And so that let me know at an early age not to say anything, to keep whatever was going on. That's why I titled my chapter, The Storm Within Me. I just swallowed whatever was going on because I knew that I couldn't trust that person to work in my behalf. Another thing I would definitely say is to keep siblings together, because like I said, by us being separated, even though we're kin by blood, it was like meeting strangers again, because our lives had taken such a different turn, and we didn't even know how to communicate. We stood outside the auditorium just looking at each other because we didn't know what to say to each other. And even now, my older sister, I was closer to my brother because I was never raised with my sister. Like I said, it was the first time I met her. But I, like Danita, took care of my brother, and 3 years age difference, because my mother would disappear for days at a time. And so I became a caretaker, and plus we lived in a transient hotel, the Garfield Hotel, in Black Bottom, Detroit's Black Bottom, which was a dangerous place, And so I became that protector. And so to meet this young man, and I'm 17 and he's 14, and he's brooding and, just even physically he looked so much different, because in my mind I still saw him as the little brother, not this young adult angry man that was standing in front of us. So I would say if you can't keep siblings together, at least keep track of them and arrange for them to meet, certain times throughout the year and talk about their experiences. Another thing that I would say, and it may not be a problem today with the technology, but it was certainly a challenge when I came through the system, is accurate record keeping. I was just sharing with them that right now I can't get a passport because I wound up with 2 birthdays And I had to hire a lawyer to resolve all that, so, and to get a certificate of live birth. And there was no one to, no family, you might as well say I don't have any family. I have an older sister, she wasn't raised with me. My father was foreign-born black, and he disappeared back to his country, so never saw him again. And no relatives, so nobody could verify my birth date. So I had 2 different birth dates in the system, which I think I've gotten resolved, but I'm still having trouble getting a passport. And, you know, so I've never been able to, I did get the driver's license that Michigan has where you can travel to Canada and New Mexico, but I still can't travel abroad. So there was all type of inaccuracies in the record. When I got older, I looked for where my mother was buried, and because we didn't have the opportunity to go to, well, she didn't have a funeral, the state buried her. And they had her buried in West Virginia. She was actually buried in Detroit. And so the record keeping was just awful back then. And the other thing is the development of a permanency plan. No child should leave the system and not know what's going to happen to them. Whether they go back to a parent or a kin, or whether you help them get into an educational setting, but no child should be out in the streets, because that just leads to the statistics that we see now. And lastly, I would talk about the mental health issues and the physical health issues. You know, again, when I exited the system, I was asthmatic, a severe asthmatic. I was epileptic and had no health care. And so, you know, of course, that is a challenge. And so, and I talk to youth. I exited the system in '71. I talk to kids that are exiting the system today, and they face the same challenge. Something is wrong with the system.
Wow.
Mm-hmm.
Well, wow. Okay. I'm agreeing with everything you just said. One of the things that continues, I mean, I'm going to say I am a trainer now for new social workers in the state of Michigan, new foster care workers. And the record keeping is a constant problem. I ask, beg, plead with the new workers, please think of this as your record. If this was your life story, wouldn't you want this information to be true? Wouldn't you want to know this? If you went back and read your life story, wouldn't you want this information to reflect what was going on in your life at this point in time? And that's how it should be reflected. Unfortunately, a lot of the information, definitely in the old way in Michigan, the way records were reflected, it's not good. I don't know about here, but I do know that we need to be very accurate in what we put in our records. We need to make sure that birth certificates are put in and that names are spelled correctly, birth dates are spelled correctly. I had one birth certificate that said that it was a male and the child was a female. I mean, so those are things that we as social workers can fix. We should fix that. We shouldn't wait until the child is 18 and they have to fix that, and they go through the financial problems of fixing something that we are responsible for while they're in care. That's one of the things that we should be fixing. We shouldn't wait and pass that on to someone else. I will tell you that one of the biggest things that drives me crazy is mental health and homelessness. I've been homeless, even though I'm 46, I will still say I've been homeless more than I've had a home. I've couch surfed more than I've had a home. I've been in my current housing for the last 15 years, but that's the longest I've lived anywhere ever in my entire life. Before that, a year was the longest I've ever lived anywhere. Being homeless makes you crazy. if you always have to think about where you're going to sleep, how you're going to sleep, where your clothes are, where your food are, where this information is, because you don't know, it makes you crazy. And we don't prepare our kids for that. Still in Michigan, we are doing that to our kids. Having a permanent plan, having them connect with someone, a mentor, a permanent person, hopefully that's going to provide them with a positive information in life, a connection, that someone that they can connect to and move forward with, is something that we try to do now. Under the Fostering Connection Act, that's what we're trying to do now. But that's something that we should have been doing all along. Okay? So that, and again, I'm going to bring this up probably again later. I tell people I have 30 mentees. It's not that I want to have that many, but one of the things that we also do, and I feel this, I've had over 100 roommates. I don't remember all of the people who remember me. But I know for a fact that people have let me go in life, and I didn't want to be let go. I don't trust people. I don't trust adults. That's what I tell people. I don't trust adults. I trust kids and I trust old people, but I don't trust adults. I let the kids decide if they want to let me go. That's fine. But I don't let them go. So if they choose to call me, if they choose to stay in contact with me, then that's fine. I call them until they no longer accept my calls. I think that that's the way it should be, because there are enough people who let kids go and say, well, you're not worth it anymore. You don't matter anymore. You know, your case is closed, so I don't have anything for you anymore. I'll just move on to the next one. Or we do what I call creaming. We'll only take the ones who are going to succeed anyway. If you're going to sink to the bottom, then we're done with you. If that's true, I never should have been here. Because trust me, I've lived in places with rats and roaches and shelters and places with holes in the walls and everything else. I should not be here. But there are people who believed in me. And I kept clawing, and if someone gave me an inch, I definitely ran with it and tried to take a mile. And I want to say that if you believe in someone, then please give them that opportunity. It's very, very hard. And yes, sometimes they might try to take advantage of you. I'm not going to lie to you. But give them that opportunity. Be open. Be open. That would be my hugest thing. Be open, but save yourself too. Save yourself too a little, okay?
There's not much to add to that, but I would agree that kids need unconditional regard. They need someone in their lives who are with them through the good times and the bad times. And a lot of times foster care kids don't have that at all. Also, as caseworkers, say what you mean and mean what you say. The kids know what your role is and what you're responsible to do on their behalf. And they know when you're not doing it. And so if you are supposed to visit them once a month for 30 minutes, do that. Do that. When you don't do what it is you're supposed to do, think of then the message that you're giving to them, that you're not important. So really try and follow through on what it is that you're supposed to do. Also, integrity is so important. Be honest. If you can't do something, say you can't do it. Don't promise kids things that you can't follow through on. If it's something that you can't do, don't promise. respect them. They deserve to be respected. They're human beings just like you are. And so we need to respect the people that we work with in that way. We need to give them respect.
Thank you. I actually have a second question, kind of as a subtext to this, and it's I guess it would be more for Danita and Claudette. I remember reading your chapter, Danita, and you had talked about working with social work students who were assigned to you as part of their training, and how at times you felt like a guinea pig, that they weren't there for the long-term care, or it was just an assignment or something like that. And we have a lot of social work students. I wonder if either of you, as a field coordinator or as somebody who had that experience, could you say something for the students about how to introduce their role, perhaps, and to do something about that experience for the people receiving services?
Could you speak a little bit more so I'm clear on what it is?
Oftentimes students will ask a question about working with a family where they don't have children themselves, or they're trying to introduce their temporary training role working with a family. And the families at times, like in Danita's situation, she talked about in her chapter, but we've heard from others as well, that the families feel like this isn't really getting services, or I am just part of a homework assignment, or I am just, you could fill in the blank. How do you address that, either with the students you're placing, or Danita's maybe suggestions you would have to introduce themselves into that role with the family, so that they can maybe avoid that feeling or experience that the family may have? I know this wasn't one of the questions you were prepared for, so if you need me to come back to that, I'd be happy to do that. But
I would just say to be honest about it. I find that whenever I'm in a tough spot, if I am just honest, and if someone says to me, well, how can you tell me what to do? You're not a parent. No, I'm not a parent, but I'm trying to learn, what it is I need to do to advocate on behalf of parents, or I need to learn the right way to help families. So I would just say be honest.
I definitely agree with being honest and letting them know maybe why you're there. You're there to learn to advocate. You care about them. That's why you're there.
thank you. I'm going to ask another question, and then we're going to open it up to questions from the audience. And this is the kind of, we sometimes refer to it as the magic question, and we talked about it just before, that if, say, President Obama came to you and said, I know the foster care system isn't working, or it's not working as well as it could work. What would you do to improve that system, to develop things that work with the system, or to renew and do different things with the system if you had an opportunity to do that? And I'm going to actually start with Claudette, because she always, being last, everybody else has got the good stuff out, and you get to be last. So I'm going to let you start, and we'll come back this way.
I really support prevention. I'd love it if no child had to be removed from their families. Regardless of how terrible a family is, kids are connected to their families. And so why don't we just start where the family is and try and work with them and support them and give them what they need to be successful. So that's the first place that I would suggest starting.
Okay. I also agree with supporting prevention, but if children are removed, regardless of adoption or whatever, I completely support siblings being placed together. Regardless of the situation, I just feel it's extremely important that siblings be placed together. And then services be wrapped around the siblings to teach them maybe how to be siblings, because if you're in a violent situation, then maybe that's how you learn to react with each other. So they might need to learn how to be nonviolent or maybe non-sexual, depending on the situation, but they need to be raised together. I have not had a situation yet where I have had a young person not try to reach out to their sibling. And it's very hurtful for them, very damaging for them when they find that they have 15, 18 siblings and they can't find them.
Well, I agree with the other panelists, but I would also, being an educator, stress education so that kinship care and, as Claudette said, prevention, the biological parents receive education on parenting, education on life skills, to help them get in an environment where they can become self-sufficient, whether it's a community college, a skilled trades program, or whatever. More resources need to be put in that direction. I would also, in the work that I do, I find out, especially in Michigan, that we don't have a central repository, if you will, of services. Everybody's doing their own thing, but you know, there's nowhere to direct a child or a parent, you know, a website or wherever, where all services, where they could see where a compilation of all services that are available. So I believe that we need a national network of resources that are available and that are easily accessed. And so that would be what I would tell President Obama.
And I'd also throw into that accountability.
Yes.
As a nation, we have just thrown accountability to the wind, and no one does what it is that they're supposed to be doing. You know, everybody's trying to make an extra buck at someone else's expense, and so we just have a system of corruption that's just unbelievable to me. And so some system of accountability.
Okay, thank you, you guys. The questions that you've answered so far, just as a quick kind of a review, the skill-based, you stress the importance of listening to not just parents but to children, honesty and integrity, talking about what you really want to do and then actually doing it, respecting people enough to make sure their records are accurate, working to prevent issues instead of always reacting to issues, essential repository of services to make it easier to access, accountability and follow through, and then also this to try to avoid abandonment at the age when people were generally leaving the foster care. Is there questions from the audience that we can start addressing? I see some hands going up. So,
as someone who works in the community with youth in foster care, I am extremely distressed by the process in which youth are transitioned out of foster care. In light of that, what is your assessment of the Ready by 21 program?
I don't know about Wisconsin's Ready by 21, but your brain is not ready until you're 25, so it really freaks me out. So, I mean, Ready by 21 to me is a start. The state of Michigan said I was ready at 18, and I'm just not there. I really do not believe that you're ready until you're 25. I think that we continue to need assistance. I think that if Wisconsin, like Michigan, said that your parent, your biological parent was not a fit parent, and they took you and they said that they're going to be your parent, then they should be your parent at least until you're 25. That's my assessment.
I've seen so many young people crash and burn, trying to be independent before they're ready. And they're just not ready at 18, 19, 20. You know, I look at my 30-year-old son and I pray hard every night. You know, that he, you know, and you kind of see it. Okay, things are clicking now and things are coming together. It takes a while for us to even mature as human beings. I mean, heck, I'm still maturing and I'm still learning about life. So, you know, and it's different for each individual. It has to do with your life experience and where you are.
I agree with life experiences and where you are. Some children may be ready to come out at 21. I assess that most will not be, because remember, if they are taken out of their home and put in the system, you know, they may be able to survive off of street smarts, but they still don't know how to navigate society. And so it takes them a while to catch up because they have not had the values and mores instilled in them at an early age because, like I said, they were removed from their homes. And so I just think that it takes time, and I think it needs to be looked at on an individual basis. But I'm grateful that they did at least go to 21.
Yes. Every time you're moved from one school system to another school system, you lose 6 months of education. If you lose 6 months of education, just think about everything else you're losing. Every other adjustment you have to make.
Good morning. Yeah, my name is Lasicia, and I provide foster home for youths 12 to 18. And I have a little bit of question for all the panelists, one at it, and I'll go through if I may stand up. And then I want to give just a little bit of my follow-up on the question that was asked about fixing the system. To the panel one, I have to apologize for your dad. I'm foreign born, and I feel bad that that happened to anybody. 2 siblings at your high school graduation. How did that come about, if you remember? And then keeping siblings together. I've tried it. I have a boy of 3 with 2 siblings, and I'd love to keep them together. But the first time I invited the big brother over, he slapped the little brother in my kitchen. And I said, you can't do that. That's abuse. That's why it's separated. I brought the little brother over, and the little brother was verbally abusive towards the big brother. And so I still try to get them out, go eat, get them together, but I actually called the county and said that something miracle have to happen, but they cannot live together because what they do at home, as you are my brother, you can't do it in my house. For the second panelist, you go into the foster care and go home. Go into foster care and go home. How did that decision come about? What did you do? They think you did right, that you are ready to go back home and go back to what at that time. And then people, you don't want people to let you go, but they do. I have just one boy that I think doesn't want me to let him go. But when he comes to me, just come to me like that, right in my face. He said, I'm a man, you are a man. When 2 men get together, one have to win. You see, I don't have that luxury. I talked to his biological dad, and he said, if somebody come to me like that, I will whip him. I can't. But it's just so challenging that I'm going to get in trouble, or, you know, so I have to let him go. He apologized. He is so good. He wants to change. But when that comes on him, very, very challenging. And then for the panel number 3, providing your emotional needs, some kids don't want to be close to you. People have told me, you are just my foster parent. I try to be close to you. I try to, I have somebody that I've been working on for about 2 years. Just last week, he came to me and said, I'm beginning to like you better now. and that's because he went back to his mom and brother, and they say, don't buy the hand that feeds you. He used those exact words that I use. But you try, but people don't be emotionally close to you. You try. And then the last one is for me. I truly, truly appreciate that in fixing the system, prevention, That is very, very important. The system was paying a friend of mine over $2,000 per month to take care of his kids for somebody that makes less than $500 per month. My friend went on and built a house. She went on to college. She has got 2 degrees and all those things. The mom is still toiling. And they are very close friends. They end up being. So if that money, like maybe 500, somebody think about, let's keep this mom at home. Let her take care of our kids. Instead of paying somebody over $2,000 per month to take care of our kids for her, who don't even know the kids. So that is, you know, and I don't have, when I started about 10 years ago, I didn't have a child of my own, but I empathize. I let them know my training. I let them know my background, what I come from, and know that I'll make a mistake, because I'm human.
Well, in response to your question for me, how did the reunification of my siblings come about? One of my friends was a relative of Judge Crockett, who was a African-American judge in Detroit. And she told him about me and not knowing where my siblings was. And my foster mother had asked me, what did I want for graduation? What did I want for a graduation present? And I told her I wanted to have my brothers and sisters with me. And so she arranged, I guess she wrote a letter to Judge Crockett, and he found them and arranged for me to have that moment in time with them. And like I said, it was good, but it was also a letdown, because I had all of this, you know, I looked at it, this was gonna be a family reunion, you know, and I had even had in my head what they would look like, you know, because like I said, I hadn't seen my brother since he was 4, and I hadn't seen my sister at all at the time. And so when I met them, it was like, I mean, we literally stood off in 3 separate corners, not knowing how to communicate with each other. My brother totally looked different, of course, and my sister, who was biracial, was not who I expected. And so it was, you know, it was a totally different experience. She was raised, like I said, in coal mining town of West Virginia, so she has that Beverly Hillbilly twang, and here I am with this big afro, Miss Black Power, you know, and I'm like trying to figure all of this out, you know, and so it was a really strange reunion, and I was just deflated. That's the best way I could express it. I said beyond high. I don't think we said anything to each other the whole time. In terms of the 2 siblings that you referred to, and I can only say what I felt. I believe that one, if not both, are feeling anger, because when I was moved from the last foster home where my brother and I were together, when I was moved, I was mad at him because he got to stay. Because I love these foster parents, and I thought that they were going to adopt both of us. And they opted, you know, after I went back, after I became an adult, and asked her why was I moved, you know. And I was moved because her brother, who lived upstairs from us, had exposed himself to me. And I had wrote about it in my diary, and she found it. And so she had me moved. She felt like she had to protect her brother, but at the same time protect me. So she had me moved, and she kept my brother, which he subsequently wound up leaving there because he stole a car and, you know, and a host of other things. So he had several foster homes after that. But in my head, I was mad because he got to stay. And so, you know, they may be dealing with anger. So, you know, you may want to seek counseling for them to see what's going on in their head.
What I didn't say is my mother also was schizophrenic. She was in several mental health institutions as well. So if she was in a hospital, and all we knew is she was in a hospital, then we would be placed in a foster home or go stay with a relative for a little while, or go stay with a friend, or we were somewhere, you know, but we didn't know where we were going or why. So if she wasn't, then we'd go back home or whatever was going on. And she had periods where she would just wander away as well. And so if she wandered away, then, you know, we could end up in foster care. It all depended on the situation, so that's why we were with her sometimes and we weren't with her a lot of times. As far as the youth challenging you, I was challenging too. I mean, I think that it boils down to trust, and I know that it's easier to say, and I'm hoping, like you were saying, that he's learning to trust you, that he sees the other way of doing things, and that maybe that's working. I will tell you that there was never, other than my last high school and college, I got kicked out of every single school I ever went to for fighting, because I was so extremely angry. I was angry that somebody else had a new coat and I didn't have a coat at all. That I was freezing to death because I had holes in my shoes, or holes in my, or the other kids were making fun of me because, you know, I'm getting a free lunch and I had to be there early for the free breakfast because I didn't have any food at home or whatever. And so I was so extremely angry with the staff because I didn't know where my brother and my sister was, or I didn't even know why I was angry, you know, and I wanted to be like everybody else. And sometimes I just truly, again, I didn't know why I was angry. He could be angry and totally don't know, and that's why he's challenging. And all I'm asking is give him a little bit more time. And definitely counseling. It might be group counseling between the two of you though. You know, and counseling. So don't give up is all I'm asking.
Sometimes it's easier for kids to push you away first.
Yes.
Before you reject them.
Yes.
So, you know, that's that whole trust issue. You know, is he gonna be there for me?
Yes.
And if he's not sure about that, then it's best for him to walk away so he's not hurt one more time, so he can control who hurts who. Don't personalize it. A lot of times, you know, foster parents, whoever the caregivers are, will personalize the behavior. It is not about you. It is not about you. As Danita said, they're angry, and a lot of times they don't even know why they're angry. Their circumstances make them angry. So it's a matter of understanding that and trying to work with that information. That being trained or being able to understand the behavior and accept the fact that when you get a child in the foster care, they are going to have behaviors, they're going to have issues because of the life that they've lived. You may not have all the information because sometimes foster care workers don't give all the information because on a Friday evening at 5 o'clock when they got a kid to place, they're not forthcoming. And so that's one of the things that I meant to throw out there. Please be forthcoming. So that foster parents aren't calling you the next week saying, come get this kid. You didn't tell me this, this, and this. And a lot of times all it takes is knowing that information up front. They're up for the challenge, but nobody wants to be lied to, or no one wants to be misled. And so, you know, just really try to understand that child's behavior and learn techniques or ways to address that anger, and then take care of yourself as you do it, because it's not about you. They're not mad at you. You know, they're pushing you. They want to know, am I going to be safe here? Is this just another home that I'm going to be in for the week, and you know, I'll be gone next week? And that's how they come in thinking. I'm not going to be here long.
Right.
You know, I've already been in 10 foster homes, so what's one more?
Right. I'd like to just piggyback on what Claudette said about being forthcoming. While it's important to be forthcoming, it's also important to educate the foster parent. And I say that because I was sexually molested at 8. It was probably in my record, or there was some discussion of it, and my last foster mother decided to, what essentially amounted to her poisoning me, because she gave me saltpeter in my food, and I was, having all these electrolyte imbalances, and the doctor couldn't find out why, and I just happened to one day see her sprinkling some white stuff on my plate, and she wasn't putting it on anybody else's plate, and later on, I went into the cabinet to see what it was, and being the curious child, I went and looked it up in the medical dictionary. And I don't know if you know what saltpeter is, but it's potassium nitrate. And folks' tales say that it keeps a young girl from being fast. And so when I confronted her about it, she said, well, I know you've been sexually molested, and my mother always told me that if a young girl has a sexual experience early in life, that she'll be promiscuous, and you're getting to that age, and so I'm gonna put this in your food. And it was literally making me sick. And that was because she was uneducated. She was working on something that her mother had told her. So yes, it's important to be forthcoming, but please educate and let people understand, especially if there's a sexual abuse situation, that it is not the child's fault.
Hi, good morning. My parents have been foster parents since for about 25 years now, so I was born into a foster care environment from a little bit different of perspective than you guys have. But sharing rooms with foster siblings and vacations and holidays, that's all I've ever known, and it's been beautiful, but also a struggle. But I guess my question is just if you could give advice to the biological children of your foster parents, what would that be, or what would you want them to know? Just living in that environment?
That's a great question. I was only in one home that had a biological child. That was my last foster home. And she hated the fact that her parents took in foster children, and I was the first one, so I got the brunt of the abuse. And I think that for the sibling, I'm not sure that the parents had a discussion with her that I was coming, or what to expect from me. And so I would say that it has to be a family decision to take foster kids into the home. And so the child needs to be involved in that process. They need to have some information up to what they can process about who's coming into their home. And because when you go into a foster home, or at least I didn't go in expecting to be totally accepted, because that it's a stigma. That you're, as they say, growing up in the care of strangers. But it was still hurtful. Like I couldn't walk to school with her because she didn't want anybody to know that I lived in her house. So I had to take a different route to school. It was also being fed by the extended family, the grandparents, because they would fuss at my foster mother who, why'd you bring these kids in here? They're going to be a bad influence on her. And so I think that it should be a family decision to open up someone's home.
I would add that the foster child wants nothing more than to be treated equally. And, want a normal existence. Now, I don't know how that's possible because, it just isn't. The circumstances aren't, they're different. But that's what foster children want. They want to be treated equally. If you get $5 to go to the movie, then the foster child wants $5 to go to the movie. But sometimes, I would say oftentimes, I think parents feel, caught. and they feel like they need to do more for their child, just to kind of let them know, you are my child, and you know, I love you, you know, more than this other child. But foster children don't understand that.
In Michigan, there's, and it is a little weird, you can spank your bio child and you can't spank a foster child. I don't know if it's true here, but please understand something. If you can hit your bio child and you can't hit a foster child, that in itself is a difference that you're drawing. So I'm just going to say that you're going to have kids do, you know, one of two things. A, if you can't hit me, then I'm going to do stuff I'm going to keep doing things to make you try to hit me, you know. Or B, I'm going to, you know, that means you don't care about me, or you don't care about me because you're not treating me like I'm your kid because you don't hit me because you hit your kid. I mean, kids all want to be treated the same. One of the first things I learned is I started calling this person mom or dad because their bio kid calls them mom or dad. And if you don't treat me exactly like you treat that kid, then, or you only want me to call you Mr. or Mrs. Smith, then I'm not going to stay there long. And I had you know, I would run away in a second. I didn't have to stay there. I knew I had other places I could leave. I knew how to, you know, survive on the streets if I needed to.
Nick, I think we'll take one more question and we'll go back.
Okay.
I spent some time in the foster care system as a child, and I'm now a Title IV student. And I'm just wondering if you have being in the helping professions, if you have any advice for people who, you know, have come out of, you know, different difficult situations, and how they can use those experiences in their practice as a social worker or helping helping professional.
Who wants to start that one? I'm going to tell you to be careful with your co-professionals. You got to be. Don't let your clients try to share the information when you're comfortable sharing it, but be careful with your co-professionals. There are people who will say, oh, you're over-sympathizing. That has been my experience, and it's been hard on quite a few people I know in Michigan. We have a group of students. We did this massive hiring thing. We hired like 500, 600 new people, and they took them old, young. If you had a human service degree, they were just hiring. However, the one group that they were least likely to hire were those who had been through the foster care experience. And then those that they did hire were the ones that they pushed out almost immediately. So be careful.
Let me say that with my experience, when we talked a little bit about this morning, my coming out wasn't until 2009. Okay, so that's when I felt the time was right. And I don't know why I selected that time, but of course that was maybe a couple of years ago. I always knew that I would talk about my experience and share it. I always knew that that would happen, even while I was in foster care. But I didn't do it until the time was right, and you'll know when that's right. But the other thing I say is establish yourself in the field. So when you make that move, it's not questioned, you know. It's seen as one more thing to support, in support of what you're doing, as rather something to use against you, if that makes sense.
we had this discussion at the breakfast table this morning, and I agree with Claudette. Wait till you have some maturity in your profession. Wait till you know that you have resolved most of your inner turmoil, whether it's through counseling or however you do that. I think if you have the mutual respect of your colleagues, that it'll be okay. Yeah, I started talking about my experiences in the early 90s, and I got all type of feedback, and actually when I came out, as Claudette said, I wasn't ready, because the first time I was asked to speak at a national conference, and I had my little speech all prepared, and I started talking, and I first started crying and couldn't continue with the presentation, because I wasn't ready, because all that emotional turmoil was still there, and I was giving voice to it. So I would say make sure that you're ready, make sure you have maturity in your profession, and that you have the mutual respect of your colleagues, and I think that they will listen if you have those factors. And I think it's important for us to tell our stories.
Thank you, great questions. The next question I'm going to ask is kind of a two-part question, and then we'll take some more questions from the audience. This has to do with placement decisions, and just your opinion, your thoughts about this. How do you feel, or do you believe it's important that children are placed with families of a similar racial or ethnic background, and why? And as professionals, if you want to speak about your experience with other racial and ethnic groups and their foster experiences. And the second piece of that is, what do you think about the current controversy around the same gender foster parents? And why don't we let Danita start this one, since we started with the other two before.
Again, I moved around a lot. After a while, I really did not care. I wanted to stay in one place. I didn't care if you were black, brown, or green. I wanted to stay in one place. And I stayed with Jewish families, I stayed with Hispanic families, I stayed with a variety of different families. I just wanted to stay in one place. So for me, I didn't care. As a professional, for quite a few of my young people, it does not matter. It depends on their history. I think for the same gender, for quite a few of them, we need more. We need more same gender. I have a kid right now. I don't know what it is about sex in America, but we have a serious problem with it. My kid is transgender. She also has mental health issues. And because of the transgender, it overpowers or overshadows the mental health issues. And so the mental health issues were never dealt with. My kid left Michigan and basically prostituted her way to California, where the mental health issues are still not being treated. And what have we done? What did we accomplish for this child? Because at 18, this person is still a child to me. If we had found a home and was able to teach this child how to be in a home, I think we could have done something. We need same gender. We need red, black, green, yellow, whatever color parents we can find for our young people to teach them how to be in a home, and we need parents of every gender.
What did I want to say? I think with the first question, thinking back, it was important to me to know myself and who I was as a young black woman. And for that reason, I say that that we start there, but we also look at homes where children feel comfortable. I think it's really up to the individual, the young person, If it's not an issue for them, then I say, you know, wherever they can find a stable, caring environment. You know, if it's important to the young person. We lose so much of ourselves as foster children that to be placed in a home outside of our race without a conversation. If the conversation is there and everybody agrees, then okay, let's go with it. But if that conversation doesn't happen, then just don't take a person of color and put them into you know, a foster home that doesn't reflect them, or the people don't look like them. But I think the conversation has to happen. In terms of same-sex, I support it wholeheartedly. We have young people out there today who desperately need a home, who desperately need someone to kind of accept them for who they are, and help them to kind of work through wherever they are. And they need a safe environment in which to do that. And they just need a loving environment.
And I will finalize it by saying that all my foster homes were African American foster homes with a lot of dysfunction. I believe that race and ethnicity has little to do with it, as long as it can provide a child with a loving, caring, stable environment. I also believe that it's important for the child not to lose his or her identity, and there are ways to do that with building a community within that child's ethnicity. I have a friend that's Caucasian, and she adopted a black child, and she couldn't do anything with her hair, as simple as that is. And so she did come to me and ask me, you know, about how to do that child's hair, and I was there for her. And it took courage for her to come and ask me. And so I believe that I'm for, you know, cross-cultural foster parenting and adoption. And in terms of LGBT, I definitely believe in same-sex adoption and foster parenting. Again, it goes back to the community and making sure that they're in a safe environment. The same rules apply as if there were a heterosexual environment, that there's safety, permanency, you know, values, morals, and all of that taught. And I believe, in fact, I know that a child can be reared in a same-sex home.
Okay, let's go back to any questions from the audience. Do you guys have questions? There's one in the back there.
Good morning. My internship is in a foster care unit in a small rural county nearby here. And recently, we were discussing a case where a girl who's 17 and a half sabotaged, I put in quotes, the last many placements that she's had. And I suggested to the group that why don't we give her some options and ask her what she wants to do or where she wants to go. And I was told that that's not how it works, and that kids can't just choose where they want. It's not like a hotel. And I'm wondering what your thoughts are on youth control over their lives in foster care.
Oh, I got lots to say. I think that's critical. That was one of the issues that I faced as a foster child, that, you know, I wasn't even respected as a human being. And like I didn't have a brain, couldn't think for myself, and couldn't make decisions for myself. And someone else who never lived my life and didn't know my story, or, well, acted as if they didn't know my story, could make decisions about what was best for me. And I think just I think it's just general the social work that you start where the client is. And if you don't, you know, how are you gonna start where they are if you don't ask, if you don't talk to them? They are the experts, in my mind. Clients are the experts on their lives, and they know what they need.
I 1,000,000,000% agree. I mean, you have to start where the client is. That's part of respecting them. Knowing they know what they want. They might not always be right, but craft with them what they want and how to get there. They might tell you they want $1 million, but okay, you don't have a job yet. How are we going to help you get there? Helping them craft what they want is what we do. That young person is probably going to tell you 17 and a half, I want to get the H out of the system. You know, I don't want to be here anymore. That's why I sabotaged it. I want out. Okay, but this is not how you go about it. What do you want? Let's see how we're going to go about you getting out of the system. That's what needs to happen. Let's work this out. That's the miracle question. If we asked you what you wanted, how would you go about doing it? What do you see yourself in 6 more months from now?
I think it's important that we work with our youth so that they can make strategic decisions, that they learn critical thinking skills along with life skills. So it's important to listen, it's important to guide or to help guide them into the right path, but you have to start with listening.
Other questions?
Well, I had a question. You were talking about the transgender child that you were working with, and I wonder, how does that work in the system with that child identifying as transgender? Were the folks that you were working with respecting that and using the right pronouns? Were y'all helping her trying to do some type of transition? Like, how does that work with a child in the system? How do you, like, deal with and also, I guess, how does, like, policies affect that? Are there, like, things that you're not allowed to do with them? Like, are you not allowed to help her want to transition?
Oh boy. Okay. No, I never use the right pronouns. That's why you hear me say him and her. I really struggle with that, so please forgive me. The right pronoun in this particular situation is her. No, the state will not pay for a transition in that particular form. However, the state is accepting that the child, although the child says that the state said that the child has sexual identity disorder, So there's something wrong with the child, you know. So that's their thing. So the state was not accepting that the child is born this way, you know. It's still a problem with the child, and it's not being dealt with correctly. The state still didn't get counseling that was appropriate for for transgender identification either. Even though I begged and we didn't have appropriate counseling for this either that was paid for by the state. So no, there were not services available, and there were not services that we were able to provide, and my youth became frustrated and decided that there were never going to be services provided. And once I contacted the transgender community, they told me to be prepared for this, and I still was not. As a matter of fact, I burst into tears at Denny's when they told me that I needed to be prepared for my youth to run, well, what she told me was to be prepared for my youth to prostitute. And I needed to be prepared to teach the youth to learn how to prostitute safely. And I'm like, whoa, that never ever occurred to me in life.
Additional questions?
there are times, particularly with teen placements, when the placement is going to disrupt. I'm thinking of my own case where I had 4 of the kids in the house, birth, foster, and adopted, and it was a weekend when they called and we're not forthcoming with the placement, and although she stayed with us for a good long while, it did disrupt. It wasn't going to work. We tried to keep her as involved in the choices, staying, and behaviors that were required, and she was also allowed to choose where she went. But can you acknowledge that there are times that a placement is just not going to work?
Yes.
Yes. Yes.
For multiple reasons.
Yes.
But yes, sometimes they just don't work.
And how then, what is the proper way? I still struggle with, we didn't do a lot of follow-up with her. There were some bad feelings when it all ended because it just didn't work the way we all wanted it to. And I don't want to leave it like that. What would you recommend to the people whose, the placements that you had that did disrupt, what would you like to have had? What would you like to have seen from them so that it didn't feel like, geez, I'm bad and I was tossed away?
Well, actually, I went back, but I went back as an adult, looking for the homes that I have been moved from, to ask that very question, because the last home that I was moved from before I transitioned out, they picked me up at school, and my stuff was already in the car. So there was no closure, you know. It's just the social worker was there, and she says you're moving to a new home, and I, said why? Well, that's not important. It's important for you to be a good girl. This is your last, this is the end of the line for you. And so I did go back as an adult and ask, why did you have me moved? And that's the Whiting household, when she had found the diary and all of that. But I guess if a social worker could give you a reason, what was going on in the home, what was the expected behavior, just so that you'll know and you'll be able to try to work. And whoever this young lady is, she may not be ready to work through it now, but she can look back on it and reflect and say, I could have did this differently and grow from it.
What we have in Michigan now, the names keep changing. They used to be called team decision-making meetings, family to family meetings, and permanency planning meetings. The names keep changing. However, we have meetings before placement and after placements, and when they turn 14 years old and so forth and so on. But we would have had a meeting prior to the situation, before the disruption, to see if this was a possibility of putting more services in place or something like that, to see if it was possible for this placement to be saved. Hopefully, maybe services or counseling or anything that might have been able to save this, and if not, why it wasn't able to be saved, so that everyone would have had that information ahead of time, and then maybe we could have done some case planning around where we could have moved the child next, so that everyone would have had that information ahead of time. I'm not sure, again, I'm sorry, I don't have that information on how things are done here in Wisconsin regarding that. But that is, I kind of don't like it, but it is very helpful to do that in Michigan, having those kinds of case planning situations.
Claudette, I'm going to ask Claudette if she would like to add into that. She wasn't here. The question that was asked was, in a case where a foster placement goes awry, what would be some of the things, or what is your experience? How do you make that as less damaging, as hurtful as part of the parties involved as possible? What ideas or suggestions do you have in regards to that?
Conversation, talking with all the parties involved, and really trying to frame it in a way that kind of leaves everybody, intact with their dignity, and because things don't always work out the way that we hope. And so I just find that trying to have a conversation that kind of puts closure on it, and in a way that folks can go away with their dignity intact.
Dan, I don't know where. Okay.
And that's the first.
I didn't see you.
I just wanted to kind of take a look at the bigger picture here for a second. I know that there's a lot of CPS workers and case managers in the audience and their students. And we have a significant problem with retention in the field because the workers feel so liable and feel sometimes as helpless as a foster child, that there's a lack of resources and a lack of time to do the documentation that so desperately needs and is taking them away from finding time to sit in kids' homes and talk to them about what they really want. You know, it just isn't enough. It seems like a bigger systems issue. I did want to say, though, that you are all a testament to the resilience of children. And in spite of the mistakes we made, there's a lot of wonderful survivors of the system. And I did CPS for 27 years, and the work that we're doing now is so much more informed. There's so much better work being done. There's planning and discussion about engagement and motivation that didn't even exist when I was a CPS worker. And so there's hope, but until there's some significant system change, I think a lot of these struggles are going to continue, and we have to be just so careful not to blame anybody. That we just really have to work together to make this different. But I'm just like so excited to see the three of you sitting here. It's just such a wonderful thing. And to see that so many of you are giving back in the same system that you came out from, it just takes incredible strength. And I thank you for coming.
I would like to thank you as well for being here and for sharing your stories. Heartfelt, I learned a lot listening to your story. I have two questions. The first one.
You gotta speak up a little bit more.
Okay, I'll speak up. The first question has to do with training for foster parents. I would like to know your thoughts about the sort of bedrock kind of training skills that are necessary, in your opinion and experience, to move into foster care. And then also how might foster parents be monitored, continue to be trained, and so on. That's the first question. Second question is, in a situation where you have a foster child who needs mental health services, how important, and this may have to do with age, maybe not, how important would it be for foster parents to be involved in family therapy with the kids that they are fostering?
Well, as you know, I'm not in the social work field, but I think it's very important for the foster parent to be involved in the counseling with the child so that they can understand what the child is going through, and of course to know what interventions that they can do, because even though the social workers are there, it's the parents that are in the house 24/7. So I think it's very important. In terms of training and monitoring, I can't speak to what currently is being done, but I think that it's very important, and I believe that it should be ongoing. Almost like being required to have so many CEUs a year, if you will, to be a foster parent.
I look at foster parenting as a profession. And I can remember back in 1980 when I did my field placement through the University of Michigan. For our agency, I developed a specialized foster care program. And I structured the parenting piece, the foster parenting piece, so that they were professional parents, because they needed to be at the table and having discussions with the staff about the work with those kids. Because, you know, they were carrying out the interventions, if you will, that were discussed in staff meetings, etc. And so I thought that with that kind of responsibility, they needed to be given recognition, paid more, and they had, to me, a lot of responsibility to make sure that young people got what they needed on, you know, on all levels, not only, you know, the basic needs level, but then when you step up the pyramid, Maslow's pyramid, you know, into the whole emotional and developmental area, that fell on them as well, and that they needed some training, that you need to understand what it is you're dealing with. You need to make a commitment to, you know, it's a big commitment when you're you know, molding the lives of whoever that's in your home. So you want to be prepared in every way that you can.
Foster parents, to me, are the bedrock. I mean, they are the most important part of foster care. We see kids, if we're lucky, half an hour, some of us a little longer than that. They have those kids 24 hours a day. Some of them, I couldn't imagine having them 24 hours a day. And so they need to be involved in the mental health part, because if there's something going on, we could tell them, well, yeah, little Joy is ADHD. Okay, no, they need to know what they need to do to help them learn how to deal with this ADHD or whatever the mental health diagnosis is. And they're the ones who are dealing with that on a regular basis. And so and medication is not always the good, you know, let's not always pop a pill. You know, let's find out how we can do this and what kind of structure we can do to help this young person deal with this behavior. And the foster parents, again, are the ones who are doing that. And I work with foster parents. They had the meeting last night without me. The first thing they did this morning is say, we needed you there last night. You know, the foster parents are constantly in Michigan getting training. Once a month, they're getting training on how to read an IEP, what resources are available in the community. I go to camp. I hate camp. I go to camp so that they can, you know, blend with the kids and find out what resources are available and do something outside of just deal with the stressors of working with the kids, and do something fun with them and find out what other stuff is available. So training is extremely important. Monitoring them, I don't know, I don't know, again, I'm sorry, what happens in Wisconsin, but in Michigan, I've been stressing, and we are not there yet, I've been stressing that foster care workers need to know what to look for in the home, because our licensing workers only go once a year. Foster care workers need to know what to look for in the home, so that they know if the foster parent is meeting the requirements. If they're not meeting the requirements of what's supposed to be going on in the home, then they need to contact licensing. And I don't, at this point, having an egress window and all of that stuff, I don't know that my foster care workers know that. I don't know.
So, there's someone in the
Okay.
back.
Yeah.
Somebody's had their hand up several times.
Yeah.
He's right in my eye.
And then you.
Hi, good morning. I'm a student, and I am really I'm really enjoying all that I have been learning, and really have a passion for social work, but I'm also finding the job and the things that I'm learning quite challenging. And one of those things is, I was asking you guys to speak to understanding that social workers are highly stigmatized for taking children away, but oftentimes when we do that, we work with the goal of returning children home. So what do you do in situations where you have a child in foster care out of home placement who is striving and doing well at home, but then we lose sight that we're working with this family, and how do we work with that dilemma where a child is doing well in foster care, but we still want to return them home, but not knowing if that's the right thing to do, or how to do that?
I think you have to work with the families at the same time that you're working with that child in foster care. Because if your intent is to return that child back to the environment, you can't return them to the same place. So I think that both things need to be happening at the same time.
Are you guys doing concurrent planning here?
Yes.
Okay. So you always have to have two plans. And if everyone is on board, and it's having that conversation. And it might be you have to have that conversation every single time, depending on your family. You might have to have that conversation every single time you see these people. That's the foster parent, the children, and the parents. Every single time you might have to have that conversation. The goal is for little Joey to go back to mom and dad. Even though they're happy here, you know, and mom and dad might need to meet the foster parents so that everybody's on the same page. You know, that the goal is going to remain the same, but just in case something should go wrong, they're going to stay here with the foster parents. Okay? But this is going to be a struggle. It's always going to be a struggle. But the insurance plan is over here, the foster parents. That insurance plan is over here.
Yeah, so my question, so you talked earlier about, we talked earlier about relative care. And I'd like to come back to that because it seems to me that's can be a, you can hear me, can't you? Yes. I never need a microphone, but this is for Ellen. So, so it seems to me that's a real dilemma frequently in the foster care system because on the one hand, there is a presumption that if it's family and if it's kin, that kids need to be really connected with them and placed with them if possible. And on the other hand, there have been certainly very difficult cases where, as you alluded to earlier, kin have not been the right placement for children. And in fact, children have died, and in fact, children have been treated very poorly. And when you look, also, when you look at your book, the totality of stories, the relatives overall in that book do not come off well. I mean, many of them have very, very difficult problems and very deep-seated problems, and kids are not safe for many of the relatives in that book. So having said all that, I'm wondering what your thoughts are on, number one, the issue of licensing kin, right, as full foster parents with all the, you know, the study and the scrutiny and the ongoing monitoring that other foster parents get, or not. And you know, it would be great if we could make this wonderful assessment up front about maybe who needs to be and who's not, but I'm not sure that we have that much foresight or insight into who folks really are. So so my question comes down to sort of what do you think about the full licensing study, ongoing monitoring, and with that certainly the full payment, right, that any other foster parent would get in the system?
I think that all young people or all kids in care want to be with family. In some shape or form, you're going to, I have yet to find, I mean, maybe 1% of my young people don't want to find any family. That being said, if they're going to end up with relatives, then we need to front load a bunch of services to make sure that they're going to get the best possible care. Like maybe there was an alcoholism problem that brought the kids into care and the kid has fetal alcohol syndrome. Let's make positive that this aunt that they're going to stay with doesn't have some kind of something going on that's going to affect this child before they get there, or once they're there, that this is going to be a situation where the child is going to be taken care of and it's not just for the money, or they're not going to ship the kid back to mom or dad or whatever. We need to make positive prior to the child being permanently placed there and an adoption or rights being terminated, that this is going to be the right move for the child before this is the permanent solution. And again, I'm sorry I didn't bone up enough on Wisconsin, but that is part of our concurrent planning in Michigan, that we give them a whole boatload of, part of our concurrent planning is we front load the services and we do a diligent search for relatives in the beginning. And part of that is part of the diligent search is to give them the front load of services once we find those relatives, which could be fixing their house and making it ready for that handicapped child or whatever, and getting them bunk beds or whatever to make that house ready, and to get them certified for licensing.
I would agree that I would support relatives going through the whole licensing process. I think that investigation needs to be done and that assessment needs to be done. And you really need to understand why is the relative willing. I think a lot of times relatives aren't willing. And sometimes they feel, you know, we have this, you know, this cultural thing where, you know, that's our family. We got to take care of our family. And it may be that they really don't want to do it. And so you're putting kids in a vulnerable situation. So we really need to assess and make sure that's not happening, that the family is willing to open their home and provide for that family person in the way that we would like for them to provide for them. And if you sense any reluctance at all, I would not go there. We don't know what the family dynamics are. We don't know, you know, when I think back my family stuff, it's like all kind of stuff going on that just carried over from years ago, that you put kids into that environment and they become victims of what happened 25 years ago between Aunt Mary and Aunt Martha. So we really need to be careful. But, you know, I think family is the placement of choice if it can be worked out. But also, you know, making sure they have the resources to do it. Because I've known some cases where because they're family, we just expect them to take care of it and to fund it and everything else. And they don't get the full complement of monies that a regular foster home would get.
Well, I feel a little bit different, maybe because of my personal situation, but in my family, dysfunction went back 3 generations. And so I am in favor, if you're going to look at kinship care, to do the licensing, the monitoring, the training, the investigation, and all of that. We can't just accept the fact because this is a relative that they are more suitable to take and raise a child and to help them to not only survive but to thrive.
Yeah, I'm a foster parent of 4 siblings, and they're going to be TPR shortly, and we plan on adopting them. Now, the caseworker asked me if I would be willing to let grandma see them after we had adopted them. What are your feelings on that?
What's happening now is what I would ask.
Well, right now, Mom's still in the picture, Dad's not in the picture, and Grandma's not in the picture.
Grandma's not in the picture?
No.
And so why would they want you to let them, I mean, why is that question being asked now?
Because Grandma still has feelings for the kids.
Why is she not allowed to now?
Because she used to have the kids over every other weekend, but the kids were had personal hygiene problem when they were over there, and other stuff had happened. And then when Dad just up and left and didn't tell the caseworker where he was going, then they didn't get to go over there for every other weekend to spend. And then of course, jail, so dad is really out of the picture, mom's in it, but.
How old are the kids?
4, 5, 7, and 8.
When was the last time you saw grandma?
Christmas time, she came over to our house for about an hour and gave them Christmas presents.
How were you with that?
Oh, I was fine with that. I get along with grandma. I don't, it don't bother me one bit.
How are you with grandma seeing the kids after you adopt them?
Well, the only thing that I'm a little leery on is that would dad step in and maybe take the kids?
Is that dad's mom?
No, dad and mom are
No,
supposed to
is
be.
that grandma? The paternal.
Yeah, that, that dad might come to grandma's and take the kids. That's the only thing that I got a little problem with.
Well, I mean, seeing doesn't necessarily mean that the kids have to go over there to, I mean, they could see them at McDonald's. They don't have to live it. They don't have to spend a whole day at grandma's house. Or how long is he in for?
He's already out.
Oh.
He just got out. And so did mom.
I would say, the structure that you have in place, there's a reason why the kids aren't going to see grandma.
Right.
And so I don't know that that should change unless circumstances change that people are comfortable with. So that would be a difficult question for me to answer right now.
I don't have enough information. I mean, but there's a way, like even if visits took place at the police station or something, visits can take place in a safe environment. There's custody places all over the place. So it all depends on, I mean, I agree with you. You don't want the kids to be ever in a situation where there's an unsafe situation. But you don't want this, they just saw her at Christmas, so they do have a relationship with her. You don't necessarily want to end the relationship with her. So I'm just wondering if there's a safe, neutral location where grandma could see the kids without grandma coming to your house, so therefore dad wouldn't know where you live.
Oh, they do know where we live.
Yeah. Oh, they already know where you live.
Oh, yeah. As a matter of fact, we used to supervise them on visits.
Well.
Yeah. And then we moved out of the house.
Well,
So that was enough.
Okay, well if they already know where you live, then what's the problem with grandma coming over every now and again?
No, but I know that.
Right, planned. I mean, not dropping by unannounced.
Right, but grandma would also like to take them.
No,
to her house. That's where I have, like a cutoff line.
No. But I mean, as far as her coming over, but I mean, a planned visit over your house is different than her taking the kids. No.
I think we have time for one more question before we wrap up.
I know nothing about social work. I'm actually a nurse. But
Yay, nurses!
being a long-term nurse, I know that there's a lot of times where there is a difference between what is ideal and what is real. And I was just hoping maybe you could add some insight to what is ideal foster living situation versus what is real. And some of it I heard where somebody was talking about how, the emphasis on documentation takes away from the actual conversation time. Where in nursing, I know that more and more we're required to document rather than actually care for a patient. And I find that to be very discouraging. If you had any insights on that.
it's breaking my heart that we are, as social workers right now, we are glorified secretaries as opposed to social workers. I came into the field of social work to be a foster care worker. Worker means you're actually working, not on the computer, you know. So it terrifies me that in order for me to actually enjoy my job, I actually have to do it after work. And a lot of people, if you have children, if you actually have a life, then you don't have the time to do that part. And so when people talk about turnover, it happens because you become frustrated that you have to get all your reports in. It's more important to get those reports in than it is to do, than to spend time with the child. And every one of us in here is an individual. It takes each person a longer time, a different amount of time to tell their story. And when there's already trust issues and everything else get in, you know, it takes a lot for a child to trust you and tell you what's going on. And so the way our system is currently built, and it's hard, you know, for us to get that from our kids and work with them to get them where we need them to be. So I'm concerned. And what I really want people to know, and I'm glad that we have so many supervisors in here. I didn't know that before. I get in trouble in Michigan for this all the time. Is I tell people we have to step outside or work within that gray area. I wore my gray today, so we all know you got to find that gray area to work in, to squeeze in that time with the kids. So I would take my kids to sports events or take them out for walks to try to build that rapport with them, to engage them in something, whether it's walking at lunchtime or meeting them at going to one of their sports events, just to find out how can I bond with that kid, or getting them something so I can get some nugget to move them forward a little bit. And that's something that we're not allowed to do because we're doing this. We don't have SACWIS yet, but it's coming, you know, and I'm scared, I'm terrified. But by the end of this year, we'll be doing that too. And, you know, we're already doing all of this paperwork. I can't imagine how much more we're going to have to do, but it's taking away from the human contact. And we need the human contact in order to do the paperwork. That's right. How am I going to find out what he likes to do if I got to keep putting in all of the, you know? I don't know how to fix that. I don't know.
Okay, I just want to thank our panelists for sharing your stories. I think you've given us a lot to think about in terms of when we go forward and change our own practice and think about the experiences of the kids who we really intend to serve, what their feelings and needs are. I also want to thank all of you for coming out today. I know parking was a nightmare, and so I really do appreciate the efforts. It's really nice to see a full room. So thank you all very much, and have a great rest of the day.